Well, sexual health can be hard to talk about, but doctors say that is the first step and it can really help.
Yeah, especially when it comes to low libido in women. We're learning more about how to address it in this week's Medical Moment.
According to the largest and most recent U.S. study on women's sexual problems and associated distress, low libido is far more common than people think.
Just under 40% of women reported low libido. Of those 40% of women, about 22% had associated distress.
Natasha DeHaan is a family nurse practitioner and certified sexual health counselor at Spectrum Health's Women's Health and Wellness Center. She says identifying the cause of low libido in women tends to be more complex.
We know that women's libido is more complicated than men's. It's multifaceted. It's not just a blood flow issue. So we try to take what's called a biopsychosocial approach when we talk to patients about low libido, which means we acknowledge that there are biologic or physical things, psychologic or mental things, and then also relationship factors.
Physical issues can include the following:
fatigue, endometriosis, medication side effects, other chronic health conditions, painful sex.
Depression, anxiety, stress, history of trauma, or body issues may be the root cause, but there is also relationship factors to consider.
Unresolved conflict can be a factor. Poor communication and lack of intimacy are probably some of the most common relationship factors.
DeHaan says low libido tends to peak during midlife, but can truly range along the lifespan.
Every age offers a different life stage with its own unique circumstances. So, for example, younger patients might be dealing with pelvic floor muscle dysfunction. Patients with low libido who are postpartum might be struggling with things like sleep deprivation and body image disturbance. And then after menopause, for sure, dryness, hot flashes.
She adds it can be tough to know when to seek help.
It's okay to get in a slump sometimes, and it will often recover. But if you're not coming out of that, if it's causing personal distress or affecting your relationship, then it's time to seek help.
Treatments for low libido may require some trial and error. So if self-care techniques, sex therapy, or couples counseling isn't proving helpful, the Women's Health and Wellness Center can offer other options.
Pelvic floor physical therapy to help with things like pain. Sometimes hormone replacement to help with menopausal symptoms, vaginal estrogen for dryness, and there are some off-label and FDA-approved medications specifically for libido that we are happy to talk through with patients.
Ultimately, DeHaan says taking that first step in talking about it is the most important one.
Conversation can normalize the topic of sex, which is so often thought to be taboo or shameful. And so your own pleasure is important, and connecting with your partner. So open up the conversation.
The Women's Health and Wellness Center is located at 4069 Lake Drive Southeast in Grand Rapids. It's right there on your screen too. To schedule an appointment or learn more, visit spectrumhealth.org. You can also call that number on your screen.